Good evening. My name is Sherika Allen, and I will be presenting to you the personality disorder named Narcissistic Personality Disorder. I would like to begin an overview of my presentation by explaining to you the definition of Narcissistic Personality Disorder, the history of Narcissistic Personality Disorder, also the definition according to the Digital Statistics Manual of Mental Health Disorder, and the case scenario and the possible treatment plan for my specific client who suffers from narcissistic personality disorder. First, personality disorder is defined as an enduring pattern of inner experiences and behavior that deviates markedly from the expectations of the individual's culture, which at least two of the following areas are affected: cognition, affectivity, interpersonal function, and impulse control. Pattern is inflexible and pervasive across a broad range of personal and social situations. Pattern is stable and long-lasting, and on its onset can be traced back to at least adolescence to young adulthood. Significant distress or impairment may be included. First of all, narcissistic personality disorder is an individual who has a distorted self-image along with unstable emotions. He or she is occupied with vanity, power, success, and personal adequacy. This disorder is characterized with an excessive sense of self-importance. This specific type of disorder is associated with being categorized as a dramatic disorder. When you think of narcissistic personality disorder, you think of someone who is consumed with self, who can no longer be affiliated or feel empathy for anyone else. They're only concerned with their personal needs at that time and what they can do for themselves, and anybody who is in a relationship with this person or acquainted with this person is seen as more of a beneficial gain. First, the history of narcissistic personality disorder is derived from a gentleman by the name of Narcissus. He was known as a Casanova, and he met a nymph by the name of Echo. Well, most Casanovas breaks hearts and known not to have the ability to love. Well, Echo was very heartbroken because Narcissus did not love her. So the gods cursed Narcissus, which made him fall in love with himself. One day, Narcissus was walking in the woods and he saw a reflection in the pool. Well, the reflection was him, and he was the object of his love, and that's where he weathered away, waiting to be loved back by himself. The DSM-V states that in order for you to be diagnosed with a narcissistic personality disorder, 9 of the following must be met. 1 must have an insatiable appetite for attention or other people, generally prone to extreme feelings of jealousy, behave as if they deserve special treatment, is preoccupied with fantasies of a limited success, power, brilliance, beauty, or ideal love, requires excessive admiration, has a sense of entitlement, lacks empathy or unwilling to recognize or identify with feelings of others, is often envious of others or believes that others are envious of him or her, and shows arrogant, haughty behaviors or attitude. 5 of these 9 traits must be met to be diagnosed with narcissistic personality disorder. DSM-5 defines narcissistic personality disorder as an all-pervasive pattern of grandiosity in fantasy or behavior, a need for admiration or adulation, and lack of empathy, usually beginning by early adulthood and present in various contexts of your life, family, and work. Next, the symptoms of narcissistic personality disorder includes: this individual often has fantasies regarding their own intelligence, success, power, and good looks. They're actually their number one fan. They find it very difficult to maintain a healthy relationship. They're extremely sensitive, commonly over-exaggerate their achievements, talents, or importance, and they only see themselves as the importance or the main concept of the whole conversation or the main situation that is being discussed. Next, I would like to introduce you to Mr. Johnson. Mr. Johnson is my case scenario that I created to explain to my audience what is the meaning behind narcissistic personality disorder. How can you identify with people with this type of disorder, and what type of treatment options does clients that suffer from this type of disorder have available to them today? Mr. Alex Johnson is a 32-year-old African-American male who appears to be preoccupied with his own desires and needs. Alex feels that he is the only person in the world that deserves attention, happiness, and success. Alex states that he has always been pampered by his mother and also extended family members. He was also supported in his achievements and also his failures. Alex has not entered a relationship that was not a beneficial gain for him. Alex does not feel that he has an issue and that many people are jealous of his attractive qualities and his financial security. Alex shared that he is mostly concerned with his life and really does not understand why he should be concerned about others. Alex stated that his mother advised for him to seek counseling due to his despicable behavior towards his family members. Alex shared that he has a difficult time maintaining a relationship due to his self-centered approach. Wow. Alex stated that he is seeking counseling in hopes to please his mother and gain professional acquaintance. So as you see, Alex's main focus is maintaining a professional acquaintance or being introduced to a professional acquaintance that may be beneficial to him. He's only seeking treatment because his mother advised for him to. He does not genuinely understand the issue that he has with himself and how his negative approach, his self-centered approach, has affected his relationship with others. Treatment process for Alex includes cognitive behavioral therapy, which is the most beneficial therapy for this type of client. A specific form of cognitive behavioral that would be beneficial to Mr. Johnson's diagnosis is this specific type of schema-focused therapy centers around repairing narcissistic schemas and the defective moods and coping styles associated with them. This is a very active and work-intensive form of treatment, and it encourages the patients to confront narcissistic cognitive distortions and has been shown to have a promising results for the treatment of narcissistic personality disorder. Please keep in mind, during the time when a client is diagnosed with narcissistic personality disorder, very rarely they seek treatment. Very rarely they are prescribed any type of psychiatric medication unless it's associated with other disorders such as anxiety or depression. Excuse me. Although prescription drugs may be used in the treatment of narcissistic personality disorder, they are not employed with the intention of curing this disorder. No combination of drugs has yet been found to be effective in eliminating the problematic behaviors typical of this disorder. However, doctors may utilize certain medications in an effort to keep associated with anxiety, guilt, and depression under drug treatment. Please be careful that when you are being prescribed any type of antipsychotic drug or antidepressants, that your doctor must know your current medications that you're taking or any over-the-counter medication that you may be taking due to severe interactions with the drugs. I do feel that Mr. Alex and I will set up a partnership and goals such as being empathetic towards others, understanding how his negative approach has affected his past relationships and his current relationships. The goals that I would have for Mr. Johnson is that he would complete a project or volunteer for a project with helping low-income population or low socioeconomic families to get outside of himself and to give back to others. And hopefully he would gain a more positive experience from that. 2, he will have to realize that how his behavior has impacted his relationships with family members, such as his mother or other extended family members. Secondly, he has to recognize and take ownership for his behavior and make a commitment into being a better person and being understanding and loving other people without considering his own needs. Now, we may face complications with Mr. Johnson. He may feel that, hey, I no longer need this treatment, and does not feel that anything is wrong with him. He may feel that it's more of a them responsibility, and that he may fault other people for the reason or the condition to where he is at in his life. 3, he may just give me self-pleasing responses in order to support his self-centeredness approach. I hope you enjoyed my presentation regarding narcissistic personality disorder. Hopefully you've gained from this presentation, and however you'll be able to use my presentation as a reference to when you're treating narcissistic personality disorder clients. Thank you.